What do we want? When do we want it?
Now.
What do we want?
Healthcare.
When do we want it?
Now.
All right, thank you. All right, next up, I would like to invite Noah Schultz, Manitoba Health Coalition, to come forward and deliver a speech to all of you lovely people. All right, please welcome Noah Schultz.
Hi folks, I missed my introduction, but I assume it was very generous and kind. As probably mentioned, I'm Noah and I'm the Provincial Director of the Manitoba Health Coalition. Just to briefly give you a sense of what we're about, we're an advocacy group calling for the expansion and improvement of healthcare, including who is covered publicly. We're primarily focused on combating privatization, keeping profit out of healthcare, because we believe, as others do here, that healthcare is a human right, not a commodity. So I'm very grateful to be here today with all of you. I wish it wasn't necessary, but it's always inspiring to remember you're not alone in this kind of a fight. So I'm here to represent the coalition and to stand with all of you in calling on the government to keep their promise. So much of what I plan to say has already been so beautifully said. So I really just want to hammer home that to you students, international students, people care about this issue. We are here to support you. I'm in health advocacy now, and this has always been an area I cared about, but I also taught in universities across Canada for over a decade, including at the University of Winnipeg for 10 years. So I saw my students, my international students, lose coverage in 2018 and how much that affected them. And I was there to see the NDP promising to restore it. So as with others, we want, and the Health Coalition, to see coverage restored. We believe that everyone deserves comprehensive, accessible, equitable healthcare, that residents of Manitoba, even if they're only here temporarily, deserve that coverage. And while I sympathize with those who feel that the public healthcare system is already under so much strain, as was so well explained by Omega and others, the numbers don't add up. It does not matter enough to, the exclusion, the amount of money saved, it just doesn't add up to the hundreds of millions of dollars they contribute. And also, crucially, even outside of the economics, the ethics of this is very straightforward. We are supposed to have a universal healthcare system. That should be true. Everyone should feel safe and respected when accessing healthcare. So the government needs to keep that promise that they so well understood was an issue of fairness and justice while in opposition. I think this is also an especially crucial time to show that international students are welcome and valued members of our communities, to resist us versus them and divisive politics that pit newcomers or international students against others in a fight for scarce public resources. We want to see more investment in public health care, more people accessing coverage, and more things covered like health, like dental care, like pharmacare. So we really believe that privatization of any kind does not help our public system, and that's what the international students are forced into. Private, for-profit insurers benefiting off of your student plans. And it doesn't mean there are suddenly more nurses in our healthcare system, more public dollars. As was mentioned, 0.05% of the budget. That's not enough to justify this exclusion or to continue to send the message that international students, for you, healthcare is a commodity, but for the rest of us, it's a right. That kind of inequality can't be tolerated. We need to keep pushing the government to change it. The economics, the ethics are clear on this, and so I'm going to really try my best to keep it brief and wrap it up there. I was going to quote the now health minister, and I'll paraphrase. Back in 2020, our health minister stood in front of the legislature and said, it's our collective responsibility to ensure everyone has health coverage, including international students, people without health cards or homes, migrant workers. We're 2 years into their mandate. I used to teach politics. I know they have the power to do this. They have a majority government. It's time to put their money and their commitments where their promises were in the campaign. So I really hope we continue to stand together and push for justice on this issue. Thanks so much, everyone.
All right, thank you so much. All right. Okay, let's do a chant. Let's do number 2. Sick or well, rich or poor, healthcare is a right. That's what we're fighting for. Sick or well, rich or poor. Sick or well, rich or poor. All right, thank you. Now we have Rebecca from Brandon Student Union, who's the health representative over there. So please welcome Rebecca from Brandon Student Union.
Good afternoon, everyone. I am grateful for this opportunity to be able to speak to you guys. It's freaking cold, but I'm gonna say this. Firstly, I think it's saddening that we're all gathered here to advocate for free healthcare, because I believe this is an offense to our right to live, because right to live is also right to free healthcare. And I'll give you some examples of the outcome or problems caused by this big problem that we're all gathered here for. The financial outcomes. Without provincial coverage, students must pay the full cost of any medical services out of pocket. A single ER visit can cost about $900 to $3,000, and hospitalization can exceed $10,000 per day. I would often make jokes with my friend that should I faint, slap me awake, or when serious, take me to the ER, but never call the ambulance. Take me by a taxi because I can't afford it. Should I wake up, I'll be in debt. We also have to look at the increased reliance on private insurance. We would have to purchase private health insurance, which is more expensive and may not cover all services. Right now, apart from the amount that I pay for my private insurance, I also pay one that the student union have brought together. That is additional $350 a year, per semester actually, to be able to cover teeth, my glasses. It doesn't even cover my full health. And then we have to look at the health outcomes. Many students may avoid seeing a doctor due to cost concerns, which can lead to worsened health outcomes or untreated conditions. I'm a nursing student myself. I'm in my third year right now, so I am well aware of the consequences if things are not treated on time. We have to look at the upstream instead of going downstream. Prevention over cure. We also have to look at the mental health impact. For a community that emphasizes on building good health, mental health for the citizens, I'm surprised we're also gathered here to complain about this. The stress of being uninsured, combined with academic pressure and financial insecurities, can worsen anxiety, depression, and isolation. Without access to preventative care, we're less likely to get routine checkups, vaccination, or early diagnosis of illness. And we also have to look at academic outcomes. We're all international students here, which means our GPA matters to us. Health issues that go untreated due to cost can lead to missed classes, reduced performance, or withdrawal from program. Just this week alone, I have a cold, and I've missed 2 classes just this week alone because I can't afford to go to the hospital. If I were to go, I'll be paying for seeing a practitioner that wouldn't do anything, just write a note for me, go get Tylenol, go get naproxen if you have pain, and go home and sleep. That's what they're gonna tell you. And we also have to look at the social and institutional outcomes. Cancelling healthcare access for international students can be viewed as inequitable and discriminatory, especially since these students pay higher tuition and contribute economically to the province. I have been here for 3 years actually, and I was told I am paying the visa student premium because I didn't contribute to the tax systems that were born on foreign land. Well, I pay $25,000 a year, and my counterpart that are domestic students pay only $7,500 a year. Just this year alone, I've been here for 3 years again. I could only afford to get my glasses 2 months ago, and I still have to pay part of that out of pocket, not covered by Blue Cross, but by the private insurance that I have to pay to the student union. Most international students work minimum wage jobs in large franchises that can afford hiring multiple workers. I, for one, live in a community where employers they do not hire international students due to our inability to work full-time. Are we supposed to spend our living stipend sent by our parents in foreign land where we also have to consider the exchange rate on healthcare cost? I can hardly afford food, I can hardly afford to eat out on my birthday, so I'm saving my living stipend to go to the hospital. We also have to consider the reduced attractiveness of the province. I'm sure we all came here because we were told, oh, Manitoba had free healthcare, it's like home away from home, and I'm here without healthcare. We also have to look at the policy and legal implications. The federal student permit requires proof of medical coverage in some cases. So loss of provincial healthcare can complicate immigration compliance. This is TMI, if you know what TMI means. This is too much information. I am living with PCOS and I have endometriosis, and I come from a family where women have fibroid. Every month I have to leave on naproxen because I can't afford to see a gynecologist. Naproxen increases your chances of getting kidney injury. I have severe heartburn. I can't eat spicy food. I'm Nigerian, I need spicy food. Because I can't afford to see a gynecologist that would prescribe maybe treatment that would help apart from taking pain medication every month. This is affecting my right to leave. And all I can say is I pray the government to reconsider this. We are pleading that they do reconsider this because you're affecting my life. I deserve to leave. And I deserve to live in good health. I was not promised this. I was promised free healthcare. So, thank you all. And let's continue fighting the good fight.
All right, I know everyone's cold, so without further ado, I'll introduce the next person. So we have Kate Kaler from Social Planning of Winnipeg. So please give a huge round of applause.
Hi, everybody. Thank you. Thank you very much. Thank you very much for the opportunity to speak here today. So yes, I'm with the Social Planning Council of Winnipeg. I won't go into our history. It's way too long. But one of our pieces of history is we actually helped found the Manitoba Health Coalition. And we host Immigration Partnership Winnipeg, which is how we got involved in a coalition called Access for All. And actually then Healthcare for All came out of that. It was the idea that nobody should be denied a city service is how it started, based on, and to be asked what their nationality is. Just like even an innocent question about what your status is. Oh, where do you come from? Those sorts of questions can be extremely intimidating for somebody, even though you're here legally. So that's how we got involved in this situation. Something else that we're involved with, though, is around a lot of issues around being unsheltered and around in poverty. And we know that there are students, both from Canada here, but also international students, who are actually unsheltered. They are couch surfing, they are finding niches, they are using the school facilities to shower and change, and so they can go to class, so they can do that. What we tell everybody you should do: get a good education, get a job, and then your life is set. So, and we're not living up to that. We're letting people who cannot actually they're barely getting by, they're unsheltered, and we're not giving them access to our healthcare system. It's so wrong-headed because, of course, we would actually like you to enjoy your time here in Canada and perhaps stay and use your education to make Canada a better place for all. Even if your plan is to not stay here and you want to go back home, guess what? We want you to tell your friends that this is a great place to come and get your education. And in order to do that, we need to support you to be here. We want our institutions to be known internationally as wonderful places to go and study. And so by not giving students healthcare, we're just taking away from our own reputation. So I do want to say, I know everybody is frustrated. I know it's easy for me to say, I've got healthcare, but there are good people in that building. And the good people, the good politicians in that building are going to tell you, we need you to keep pushing us from the outside so we can push from the inside. So all I'm going to say is, we've got a ways to go to budget time. I totally heard the throne speech is important, but those are often pretty words. What matters is what goes into the budget, and that's next year. So I'm going to say, keep up the fight, stay loud, and stay proud. Take care.
Thank you so much, Kate. All right, let's do a chant. Number 3, our health, our right. And you say, we won't give up this fight. Our health, our right.
We won't give up this fight.
Our health, our right.
We won't give up this fight.
Our health, our right.
We won't give up this fight.
All right, thank you so much. Next up, we have our own UWSA Vice President, Harleen, Vice President Student Affairs, Harleen Dio. So let's welcome Harleen.
It's pretty cold, guys. I'm freezing. So if my voice shakes, please avoid that. Okay. Good afternoon, everyone. I just wanted to thank you all for coming here today, first of all, because your presence shows how deeply we care about the fairness, dignity, and the justice for every student who calls Manitoba home. And I just wanted to share a little personal story here regarding the healthcare that maybe a lot of students must be facing. So this week I had a very bad toothache in my tooth, and I went to the dentist. So there was a technical issue and my insurance card didn't work. So I had to pay upfront $250. And imagine if that happens and your paycheck is not in your bank account. Imagine if that happens if you're not well off from your home and you're paying your tuition and you don't have money in your account. What if this happens to you? What if you have to pay hundreds of dollars and then amount never gets reimbursed? That uncertainty, that fear, it's something international students in Manitoba live with every single day. And let's be clear, this is not just a new issue. This is not just a new issue. Healthcare for international students was cut before, and we are told by the government that they would bring it back. This was their promise. But here, we're still waiting. Meanwhile, students are paying enormous amounts. Like for our university, it's about $1,300 to $1,400 per year that an international student pays for their insurance. And on top of that, we are paying about $24,000 as our tuition, which doesn't seem fair to me. And healthcare is not the only challenge international students face. We face buses getting late when we are going for work or the school. We face this winter where we have no accommodations and the rent is getting higher. We face the grocery prices going higher, and we face the struggles from the racism. We are facing all these issues with accordance to the finances too. And back home, we might seem like we are from rich families, but to be honest, the reality is not that. We come from middle class families, and our parents are struggling very much for us to study abroad, and we are struggling here to pay for our tuition and our healthcare. And just ask yourself, even the domestic students, is this fair for us? International students are not just visitors. We are a part of this province. We study here, we work here. We volunteer here. We pay taxes here. We contribute to Manitoba's economy and its future. Yet, we are denied one of the most basic human rights, access to healthcare. Let me say this clearly, healthcare is not a privilege, it's a necessity. That's what have been told to us, and that is true. Denying healthcare to international students is unfair, it is unjust, and it goes against the values of compassion and equality the Manitoba should stand for. And reinstating healthcare is not just about helping international students. It's about building healthier Manitoba. And when the argument is against why we should reinstate healthcare for international students, like why? So to be fair, when international students are neglected, more of the run is in the emergency hospitals, right? So when the healthcare is there, there's no need to go to the emergencies. They can just go to the doctor, and maybe the treatment is done before they have an emergency. So today we are calling on the Manitoba government, keep your promise, reinstate the healthcare for international students, do the right thing. To my fellow students, I just want to say, whoever came here, and to be honest, all the people standing here from the U of W, because I know for a fact they had classes and they came here just because they know this is an issue, this is the voice where we need them and where we need to hear them. And thank you so much, whoever showed up. We really appreciate you coming here, and we are proud that you are standing for yourself, for your rights, and for your healthcare. Manitoba should be a place where everyone can thrive, where no one is left behind. Because we are the ones who were not born here, but we are the ones living here. Today, we remind our leaders, we are not asking for special treatment. We are not asking for special treatment. We are asking for equal treatment. What we are asking for?
Equal treatment.
Together, let's make our voices loud and clear. International students deserves healthcare, and we will not stop until we get it back. Thank you.
Yeah. Go Herlene.
All right, thank you so much. All right, let's do another chant. We're not numbers, we're not fees. And you say, we deserve healthcare if you please. We're not numbers, we're not fees.
We deserve healthcare if you please.
We're not numbers, we're not fees.
We deserve healthcare if you please.
We're not numbers, we're not fees.
We deserve healthcare if you please.
All right, thank you. Next up, we have Diva for Healthcare for All. Diva? Oh, he's standing over there. All right, let's have you up over here. Please give a huge round of applause.
Thank you, Alan. Thank you to everyone who's here today and who showed up. Students, workers, organizers, allies. Thank you for refusing to stay silent. Because when we come together like this, we remind Manitoba that we are not invisible and we are not alone. Students, workers, allies, people who care for one another, even when those in power refuse to. We are here because we believe in something very simple and powerful. Healthcare is a human right. And when governments deny healthcare, that's not an accident. That is an active choice. When Manitoba cut international students from public healthcare in 2018, it wasn't about saving money. It was about sending a message that some lives are worth less. And what does that message convey? That if you come from another country, if you're here to study and work, you should be grateful for scraps. But this isn't about budgets. It's about a false narrative. A story meant to divide us, meant to other us. We've all heard it, and I've heard it as an advocate for migrant workers and immigrants. They're taking our jobs. They're driving up our rents. They're increasing the price of housing. They're a drain on the system. That's the lie. That's the narrative. That's how governments shift the blame for their own failures by turning working people against each other instead of against the real sources of inequality. The truth? International students and migrants are not a burden. We are the ones holding this province together. We are the ones who pay more, work harder, and give back more than we ever receive. Each year, international students bring hundreds of millions of dollars into Manitoba through tuition, rent, groceries, taxes, work. Meanwhile, the cost of including them in public health care is a tiny fraction of that. And again, cutting health care doesn't save money. It costs lives and reinforces that narrative that was never based on numbers, but only on prejudice. And if anyone needs a reminder of who really keeps this province going, just look at what happened during the pandemic. When Manitoba shut down, when offices closed, when others were staying home, who kept working? It was us, it was migrant workers. It was international students who had their hours increased. You were called essential. You were asked to step up. You were asked to put your bodies on the line, and you did. You work when no one else would, you care when others couldn't, and now after everything, the same government dares to tell us we don't deserve care. That's not economics, that's hypocrisy. That's moral failure disguised as policy. So to the government of Manitoba, we say, a choice was made to cut healthcare. Now you have a choice to fix it. When you deny healthcare to international students, you're not balancing a budget. You're reinforcing a lie. You're saying, our lives don't matter as much as others. And we're here to tell you we see through it. Do the right thing, do it now. Not because it's politically easy, but because it's morally necessary. We are not asking for favors, we are demanding fairness. We are not asking for sympathy, we are demanding solidarity. We are not asking for charity, we are demanding justice. What's scarier than no health care? A province that knows the harm it's doing and keeps doing it anyway. But that's not the Manitoba we believe in. We believe in a Manitoba where no one is left behind, where students and workers, migrants and citizens all have the same right to be healthy, safe and cared for. Where healthcare for all truly means for all. So let's keep standing together. Let's be louder. Let's make our presence heard. Because we know what we deserve, we know what's right, and we will not stop until we win. Thank you, everyone. Keep fighting, keep shouting, keep organizing. Back to Alan.
Thank you so much. All right, now we have Michael from CFS coming up to speak. Give a huge round of applause for Michael.
Good afternoon, everyone. I would like to thank you all for being here today. That shows our voice is going to be heard better. My name is Michael. I'm the treasurer for the CFSMB, the Canada Student Federation of Manitoba. I speak here not just as a treasurer of the CFSMB, but as a domestic student who truly is truly deeply concerned about the well-being of the international students' friends. We are here today because we believe in one simple truth. Healthcare is a human right, not a privilege. Right now, international students in Manitoba who work here, study here, and pay some of the highest tuition fee in the country are being denied the right of healthcare. That is wrong. When a student gets sick, they shouldn't have the choose between seeing a doctor or paying their rent. International students contribute millions of dollars to the province every year. They volunteer, they pay their tax. Even in British Columbia and Saskatchewan and Newfoundland, they also give free healthcare to international students. So we're calling for the government of Manitoba to also do the same. Healthcare is not our right, it's our privilege. Thank you.
Thank you, Michael, for that. Let's do a chant. All right. Our health, our right. We won't give up this fight. Our health, our right.
We won't give up this fight.
Our health, our right.
We won't give up this fight.
Our health, our right.
We won't give up this fight.
Our health, our right.
We won't give up this fight.
All right. Now we have a few student testimonials, and then we'll be wrapping up. We have Aisha coming forward to give a student testimonial on the topic. My teeth are biting itself. It's cold.
Good morning, everyone. Again, mind my jaw. It's freezing up. I'm the community liaison director here at the UWSA. I had a few things I wanted to say. First of all, thank you for everyone who came out, especially with how cold it is, and our energy is amazing. Secondly, I wanted to talk about healthcare, which is what we're here for. I'm gonna keep moving around, so bear with me because it's freezing. One of the main things I'd like to point out is some of the wonderful work that our executives are doing at UMSU, at UWSA, at Red River. And one of the things I would like to point out is the fact that the term that international students are demanding healthcare is not correct. Healthcare was promised to us by this government, and they're faltering, and they're failing, and they're making us wait. We have speakers here from Healthcare Coalition, for example, showing that healthcare is a right. I'm a domestic student. I'm up here speaking because I've seen too many of my international student loved ones be treated differently than me for basic rights. I'm never gonna forget how jarring it was for me to compare my tuition, my one semester being the cost of 2 courses or 1 course for my friends. I'm never gonna forget the fact that my coworkers sat through an 8-hour shift with a bleeding gum. I'm never gonna forget the fact that I had no idea what was going on. I wanna take this time again to understand and to show everyone that this is not a demand, but it's a right. And I'm gonna pass the mic now to University of Winnipeg alumni. Garen, he's an older brother to me. We've only met a little while ago, but I'm sure he has a lot to say on this. I'm gonna pass over to you. And thank you so much again for being here. All of us, I see so many jaws
What do we want?
Healthcare.
When do we want it?
Now.
What do we want?
Healthcare.
When do we want it?
Now.
What do we want?
Healthcare.
When do we want it?
Now.
Thank you, everyone.
Thanks. Sorry for the delay there. It's freezing cold. But I do wanted to show my sweatshirt from my university days. Hi everyone, my name is Kiran Lama. I'm one of the international students from Nepal. I recently graduated, but that doesn't mean that I don't want to fight for all my friends who are still in school. And going through that journey, I do know the value of like getting that free healthcare, and I think we deserve it. When I first came to Manitoba, I came with same hopes as thousands of other international students to learn, to grow, and to build a better life. We came here not just as students, but as dreamers, ready to give everything we have to make that dream real. But along the way, I began to realize something that many of us share. This journey is not easy. It was filled with long hours, minimum wage jobs, skipped meals, sleepless nights, and the constant weight of being far away from home. We carry our family hopes with us, and we navigate through schoolwork and visa pressure all at once. And I do believe it's just not my story, it's the shared experience for all of us, with my friends, with my classmates. Whenever I go to work, I see my friends in the kitchen, working so hard, standing for 8-10 hours, sometimes even skipping breaks just to catch up their work or like do their assignments whenever they get a chance. And every now and then, I just get this worry. What if one of us get hurt? What if I burn myself out? Saying that all my coworkers always tell me, Kiran, you're working way too hard, you're burning yourself. But I do think like it's just not me working, all my friends do the same thing. It's not because we are definitely chasing our dreams, but it's also like a big mandatory thing for us because we have so much bills and everything to pay for. And while doing that, one of the thoughts that always scares me is, what if I get sick? And it's just that like, not just getting sick, it's about like the cost that comes to it. I've never gone to a hospital for a physical visit out to a clinic or anything, because I just don't want to pay that bill. And it always scares me. Like I should probably do I think like doing a regular checkup is a must and necessity for everyone, especially for international students who work so hard. And don't get me wrong, I believe international students like us are one of the hardest working people. And we do that, we study, and we contribute to this province. And Manitoba, after 5 years for me, is basically a second home for me. And I'm proud of what this province represents. I'm grateful to the institution like University of Winnipeg and others to give us a chance to learn and grow. But I do feel true growth happens when everyone feels safe and supported, not just academically, but in health and well-being too. That's why I believe it's not just important, but necessary for the province to restore free healthcare for international students. Because when you invest in students' health, you invest in their potential. When students feel supported, they perform better, academically or even work. They contribute more and they give back to the community that gave chance to them. International students not only bring tuition money, we bring skills, ideas, and energy and dedication. We work in restaurants, in labs, care homes, late night hours, and we also in classrooms. We help Manitoba to run, and in return, all we are asking is for a basic security of knowing that if something goes wrong, we will be cared just like everyone else. Healthcare is just not a service, it's a message that says, you belong here, we see your effort, we value your contribution. I believe that by restoring free healthcare for international students, Manitoba can once again show that it leads with compassion, fairness, and community. So today, I speak not just for myself, but for all the students who are scared to get sick, for all the friends who go to work tired but determined, and for the families back home who trust this province with their children's future. We are not outsiders, we are part of the Manitoba story, and hope this province stands with us and as the way we have stood with it. Thank you guys.
Thank you so much, Karen. That was so powerful and so real. I've seen this guy work quite a lot, and even after graduating, hardest person I know. And international students are just the hardest people. They just work so much and still able to carry through and give so much to the community, and I'm so proud to represent that. Today wasn't just a rally, it was a reminder of our power. We've heard the stories, we've made the case, and we've made it impossible to ignore. Health care belongs to everyone, and we won't stop until it's restored. Thank you all for being here, for showing up, and for standing together. We'll keep going because students deserve care, dignity, and action. Thank you so much. Thank you so much, everyone, for coming. There's some coffee. Please warm yourself up with some warm coffee. Take some pictures, and yeah, cheers.